Assalamualaikum and hi everyone. Today I want to present about my internship journey at Feline Animal Medical Center, FAMC. Next, the vision of this clinic. Firstly, the company dedicated to enhance veterinary practice. They offer a welcoming environment and top-tier services, all supported by state-of-the-art facilities. This ensures that every visit provides a superior veterinary experience for both pets and their owners. Secondly, the company committed to empower future professionals. They committed to advance veterinary professionalism across the company. They believe in nurturing the next generation of veterinary experts to continue the legacy of excellence in care and services. Next, we move to mission of this clinic. Firstly, they strive to create a warm and inviting environment. Their goal is to ensure that both customers and their pets feel comfortable and valued every time they visit. Secondly, they believe in building long-lasting relationships. They are dedicated to foster enduring bonds with both our customers and their pets. Lastly, they aim to make each visit a positive and rewarding experience. Each visit is aimed at being a pleasant experience for customers and pets, providing the care and support they deserve. Then, the services provided by this clinic. Firstly, they specialize in preventive medicines. They prioritize in keeping your pets healthy with regular checkups and vaccinations. Secondly, they excel in advanced surgical procedures. Their clinic is fully equipped to handle a range of surgical needs with precision and care. Lastly, they offer friendly grooming sessions, ensuring pets look and feel their best with professional groomings. Let's proceed to my mini project titled Feline Health Resilience, Integrating FCoV Measures into Veterinary Practices. The objective of this mini project is to enhance feline health resilience by integrating feline coronavirus FCoV prevention and control measures into standard veterinary practices, thereby improving overall health outcomes and reducing the incidence of FCoV-related diseases in cats. What you need to know about feline coronavirus. Feline coronavirus FCoV is a common viral infection in cats that causes mild gastrointestinal problems. FCoV undergo mutation and transform into FIP virus, which lets it spread beyond the gastrointestinal tract. This happens when the feline coronavirus experiences genetic mutation that shift its specificity from infecting intestinal cells to impact immune system cells. Subsequently, the virus spreads throughout the cat's body, triggering inflammation on a systemic level. The most common rate of FCoV infection is fecal oral transmission. This happens in households with multiple cats, with shared litter boxes being a primary source of transmission. The diagnosis involves blood tests and stool tests. Blood tests to detect antibodies, while the stool tests to detect the virus. There are two main types of FCoV. First, feline enteric coronavirus FECV. This form of the virus primarily infects the intestines of cats. It usually causes mild, often asymptomatic, gastrointestinal symptoms such as diarrhea. It also highly contagious and spreads easily through fecal oral transmission, especially in multi-cat environments like shelters and catteries. Second, feline infectious peritonitis virus FIPV. This is a mutated form of FECV. FIPV can cause FIP, which is a serious, often fatal systemic disease. FIP can present in two forms, the infusive form and the non-infusive form. The virus being able to infect macrophages, a type of immune cell, leading to a severe immune-mediated inflammatory response. Here is the difference between effusive and non-effusive FIP. Diffusive FIP, also known as wet FIP, is characterized by the accumulation of fluid in body cavities, particularly in the abdomen or chest. This fluid buildup, known as effusion, is typically yellowish and contains high levels of protein. Effusive FIP often presents with symptoms such as abdominal distension, difficulty breathing, weight loss, and lethargy. Cats with effusive FIP may have a more rapid progression of the disease compared to non-effusive FIP. Effusive FIP is considered more common than the non-effusive form. Next, the non-effusive FIP is characterized by the formation of granulomas or inflammatory lesions in various organs throughout the body. These lesions can affect organs such as the liver, kidneys, spleen, and central nervous system. Unlike effusive FIP, there is typically no significant fluid accumulation in body cavities. Cats with non-effusive FIP may exhibit symptoms such as fever, weight loss, jaundice, neurological abnormalities, and ocular eye changes. Non-effusive FIP tends to progress more slowly than the effusive form, and it can be more challenging to diagnose due to the lack of characteristic fluid accumulation. Feline coronavirus FCoV is primarily transmitted through the fecal-oral route. It involves in virus shedding that occurs when infected cats shed the virus in their faces, which is the primary way the virus spreads. Then, environmental contamination happens as the virus can contaminate litter boxes, bedding, food bowls, and other surfaces where fecal matter may be present. Next, the ingestion of the virus from contaminated surfaces, grooming, or shed litter boxes leads to infection in other cats. From direct contact, it involves close physical contact such as grooming, which facilitates virus spread, and then the less common saliva and respiratory secretions can also transmit the virus through close contact. Indirect contact includes humans acting as vomits, inadvertently transmitting the virus on their hands, clothing, or shoes after handling contaminated items or infected cats. Next, the shared objects like food and water bowls, bedding, and toys can also spread the virus if contaminated with fecal matter containing the virus. When discussing the symptoms of FECV and FIPV, it's important to note the differences. FECV is typically mild or asymptomatic, occasionally causing mild diarrhea or mild upper respiratory symptoms. In contrast, FIPV presents with a gradual onset of non-specific symptoms such as a persistent fever, weight loss, and poor appetite. Additionally, fluid accumulation in the abdomen or chest is a common and significant indicator of FIPV. Like I said previously, for diagnosis there are two types of diagnosis, which is first one is stool testing and the second one is blood testing. So, for stool testing, it detects the presence of the FCoV virus itself by antigen and indicates an active infection. First, a stool sample collected and mixed it with diluent. Then, A small amount of stool sample is placed onto the FCoV antibody test kit. After 10 minutes, the result was observed. The double line indicates positive, while a single line indicates negative at FCoV AG. Next, for blood testing, it detects the antibodies produced by the cat's immune system in response to FCoV infection. First, a blood sample collected. Then, a small amount of blood sample is placed onto the FCoV antibody test kit. Next, a diluent solution was applied to the blood sample. After 10 minutes, the result was observed. The double line indicates a positive while a single line indicates negative at FCoV AB. Here is a short video on diagnosis of FCoV. Further blood test needs to be done if tested positive. A blood sample collected, then the complete blood count CBC checked using IDESX peroxide DS analyzer. Next, a CAM17 was performed to obtain comprehensive chemistry details using IDESX catalyzed 1 veterinary chemistry analyzer. Here are the results for one of our patients named Orient who was diagnosed with FCoV. First, we see the result of CBC. There are a few mild abnormalities that could be indicative of infection. These include a high white blood cell count, then a high neutrophil count, which is a type of white blood cell that helps fight infection. Also, a high lymphocyte count, which is another type of white blood cell that is involved in the immune response. Next, the result of CAM17. The abnormalities seen in the CAM17 test result in the image include a high in blood urea nitrogen. This can indicate kidney dysfunction. Next, a low albumin. This can be a sign of inflammation or liver disease. Also, a high alanine aminotransferase. This is an enzyme found in the liver and kidneys. Elevated levels can suggest damage to these organs. Next, here are the results for one of our patients named Noja who was diagnosed with FIP. The condition appeared more severe compared to typical FCoV patients as depicted in the image. There are a few mild abnormalities that could be indicative of infection. These include a high white blood cell count, then a high neutrophil count, which is a type of white blood cell that helps fight infection, and a low platelet count caused by FIP leads to decreased platelet production due to bone marrow suppression. For CAM17 analysis, it's quite similar with the FCoV result. The abnormalities seen in the CAM70 test results in the image include high blood urea nitrogen. This can indicate kidney dysfunction, and a low albumin that can be a sign of inflammation or liver disease. Also, a high alanine aminotransferase. This is an enzyme found in the liver and kidneys that elevated level can suggest damage to these organs. Then, we move to FCoV treatment. FCoV is generally managed with supportive care as there is no specific antiviral treatment. The approach focuses on maintaining hydration, nutritional support, and general well-being, often utilizing IV drips. Additionally, symptoms like inflammation and diarrhea are treated with medications. For instance, Onsio is used for inflammation, while procholine enterogenic and guaifenesin are used for diarrhea. Supplements or medications like methocobalt, cephaloxin, and viucid may also be recommended to bolster the immune system. Lastly, regular veterinary checkups are crucial for monitoring the cat's condition. The treatment for FIP includes the use of GS injection, a promising antiviral that has been successfully used by many. Additionally, maintaining hydration, providing nutritional support, and managing pain are often addressed with IV drips. Supplements or medications such as methocobalt and coamoxiclav may be recommended to strengthen the immune system. Specific symptoms are also treated with appropriate medications such as serratiopeptidase and prednisolone for inflammation, Usofac for kidney issues, and renal and PACE for diarrhea. Lastly, regular veterinary checkups are crucial for monitoring the cat's condition. Okay, next, prevention. First and foremost, vaccination is a key. It's crucial to consult with a veterinarian to discuss available vaccines and their effectiveness in preventing FCoV. This proactive measure can significantly reduce the risk of infection in your feline companions. Next, regular monitoring of your cat's health is essential. Schedule routine veterinary checkups to monitor their overall health and detect any potential issues early on. This helps in timely management and ensure your cat stays healthy. Additionally, if symptoms suggestive of FCoV arrive, especially in multi-cat household, conducting FCoV testing is recommended. This helps identify carriers and manage the spread of the virus effectively. Next, maintaining good hygiene practices is another important step. Regularly clean and disinfect litter boxes, food bowls, and bedding to minimize the risk of viral contamination in your cat's environment. In cases where a cat tests positive for FCoV, isolating them from healthy cats is crucial. This prevents transmission and further spread of the virus among other feline companions. Lastly, consider the density of cats in a living space. Lowering the number of cats in a single environment can reduce the likelihood of virus transmission and help maintain a healthier living environment for all cats involved. In summary, our goal is to improve the general health of cats and reduce the occurrence of FCoV-related illness through these initiatives. These actions collectively work to safeguard the welfare of cats and elevate veterinary standards. Remember, proactive care and consistent veterinary oversight are essential for ensuring your feline companions enjoy long, healthy lives. Overall, during my internship, I gained valuable hands-on experience in veterinary practice, focusing on the diagnosis and management of FCoV. Conducting lab tests enhanced my understanding of disease prevention and control, particularly in multi-cat environments. This experience has deepened my knowledge and prepared me for future roles in veterinary medicine, emphasizing the importance of routine testing and proactive care.